Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison. It's a pleasure to be here.
Our topic today is whooping cough. Dr. Raja, what is whooping cough?
So whooping cough is a bacterial disease, so a disease caused by a bacterium that infects human beings. And the main symptom that the person feels when they have this infection is this thing that we call a whooping cough.
So Dr. Raja, are there any other symptoms?
So the main symptom is the whooping cough. It's a very specific type of cough. Otherwise, the other symptoms tend to be very similar to a common cold, like a runny nose, a cold-like symptom, but the cough that goes with the infection is very unique and very different.
So how is this directly affecting college students?
The problem with whooping cough is it's highly contagious. So if you live in a home or you live with other people who may harbor this microorganism, this bacterium, and they have this disease condition, they could easily transmit it over to you. Or you live surrounded by lots of other college students who may have come in contact with some other people who have this infection. And it spreads very rapidly and very easily, which is why it's of risk at times in a college population. But in general, it's a cough that is a result of a bacterial infection. And it's a cough where the individual just goes into these fits of cough. And it can go on. They can have this cough for anywhere around close to 10 weeks, which is really a very long time to have a cough and a symptomatic condition.
How can people prevent getting this cough?
The best way to prevent getting this cough is to actually get vaccinated against it. And in fact, there are 2 vaccines that are available. And in fact, most people in the United States would have been vaccinated against it. We all get this vaccine against this microorganism Bordetella pertussis when we're very young. And as long as you've been vaccinated, you've been prevented from getting this whooping cough later in your life. But if you have not been vaccinated against this, then the only way to really prevent getting this cough is to make sure you're not in an environment where someone likely has this type of a cough. And that is always hard to determine because you often don't know if that cough that person is really coughing is whooping cough. And usually it tends to be, you figure that out quite late in the game. However, even if that happens, there are options available for treatment purposes.
And what are the treatments?
There are a couple of treatments available. There are a couple of antibiotics out on the market that are available against Bordetella pertussis. And in those instances, if you've been battling this cough for 6 weeks, 8 weeks, 10 weeks, then you would have to go in and see a physician to get the antibiotics. Now, the problem with pertussis or whooping cough is really much bigger in very young children. So children who are below the age of 1 or below the age of 7, this disease, if they get this disease, it can be really life-threatening for them because you kind of imagine someone has this really uncontrollable cough. An adult having an uncontrollable cough is one thing versus a very young child having it. And the other unfortunate situation is oftentimes very young children don't present with a cough. So they may have the infection, they may not have a cough, but they'll just have really difficulty breathing, and then it can be really fatal for them. So in their cases, there are treatments still, but there aren't that many antibiotics you can give young children. So making it complicated for the younger population, but the antibiotics work for the older population.
Any last thoughts?
The main last thoughts would be to figure out first, perhaps, if you have had this vaccine. It's easy to go look up your vaccination history, and it's called either the DTaP or the Tdap. There are 2 different types of vaccines. See if you've been vaccinated. If you've been vaccinated, you're protected. And if you have not, just be aware that perhaps this disease is going around, and so that you will be able to go see a physician the moment you have some kind of cough symptom so that you can catch it early.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.